Hello and welcome to Caregivers First, the show brought to you by SCAN, helping active adults stay informed and empowered. My name is Lavelle Jones. Thank you for joining us. Today, we're going to discuss an important issue that many caregivers face: managing end of life decisions and palliative care. I'm so pleased to have as my guest Dr. Shira Goldberg. Dr. Goldberg currently serves as the VNA Health Group's Medical Director for Hospice and Palliative Care for Monmouth Medical Center in Long Branch, New Jersey. She's a graduate of the Icahn School of Medicine, New York. She's a board certified member in internal medicine, geriatric medicine, and hospice and palliative medicine. After working in the field as a primary care geriatrician since 2010, she joined the VNA Health Group to expand their clinical team in palliative care and hospice. In her capacity as a clinician educator at Monmouth Medical Center, she is the sole consultant for palliative care and serves as the medical director for the Inpatient Hospice program. Apart from her clinical duties, Dr. Goldberg's passion is education. She enjoys exploring new and innovative ways to teach the next generation of the clinical care team. She tries to focus on the importance of understanding and incorporating the principles of palliative care into their clinical thought process. Welcome to the show, Dr. Goldberg.
Thanks for having me.
It is so great to have you here. Managing end-of-life decisions is such a sensitive issue. And I'm thinking that planning is probably involved. So my first question is, what is advanced care planning and when is the right time to start those discussions?
So it kind of seems self-intuitive, right? Advanced care planning. So it's really a time to start thinking about what's important to you, what the values are of the person who's going through that care, what the values of the family unit are, for all those caregivers out there, is that it's about the patient and their caregivers and their family as to how they see their care, their medical care moving forward when they have an illness. There's probably never the best time to have that conversation, right? It's always important to be continuing that conversation. But what I want to kind of emphasize is that it's always good to start that conversation, because the earlier the better. Because what happens if you don't have those conversations on the earlier end of someone's illness is that we get into stressful situations when having those conversations are really challenging. There's a larger emotional component. There's a lot of stress. There's a lot of unknown. And so having an open dialogue early on, as early as you can actually, for someone who has a chronic medical illness is always the best. Those care plans will change over time. And that's normal. That's the way human beings are. But if you start that conversation early, then you know kind of the trajectory where you're going, what the guiding light is in terms of how to guide your care plan. And that will change with time, right? We all hit those roadblocks in life about chronic illness and things that happen in our lives, as we've all experienced over the last few months. But if you have had some sense of a conversation of what that guiding light is, it helps move you in the direction that you always want to be in.
That's terrific. Thank you. And if I could just follow up, because you mentioned planning for those who have chronic illnesses. And is planning important for both chronic illnesses and terminal illnesses when you're dealing with patients?
Yeah, for both. The elements of what you have to consider are different, right? Someone with a chronic illness may need some extra care along the way, how to decide who's going to be the care system around them, what kind of help you might need, finding the right doctors to surround yourself with. All those things are true of even a chronic illness that we anticipate will become more difficult along the way. Someone who's terminal is at the end stage of that chronic illness. And so certainly we ramp up the support that they need and the conversations you need to have, but it stemmed from that chronic illness most likely, in most cases. And so having that conversation when you first were diagnosed with a chronic illness, or you start to have more difficulty with that chronic illness, always leads you then to understanding when it does become terminal from a medical standpoint, you've already started some of those conversations, and kind of knew more about your chronic illness, right?
Yes, yes.
A lot of what's difficult about care planning is that many patients and their families don't really understand what their disease process is and what it's going to look like in 6 months from now. But if you are an advocate for yourself and ask those questions because you want to have an advanced care plan, then you have the opportunity to get the answers you need to make all those informed decisions about what you want your world to be like as
Yes.
this chronic illness may become more challenging.
Thank you very much. That answers my question. And so let's talk a little bit about the benefits of advanced care planning. You touched on it a little bit. Tell us a little more about why it's really a good idea to have that ACP.
So I think it benefits everybody involved, and we could talk about that individually. So it helps the patient themselves because they are then their own advocate. They have that empowerment to decide how they want things to go. In this world, we're sometimes at the whim of doctors like myself, right, who want to try to offer more things that may not be in light with what I want. And the important part of advanced care plan is that it's identifying and honoring who that person is and what your value systems are. So for the patient, it gives them control in a lot of times when there's a lot less control in their healthcare. For caregivers, it's of utmost importance because at some point you may be making decisions for your loved one and you want to know more about it. It's a huge gift to provide that guidance for family members who then might be struggling with some difficult decisions later on when they are in a terminal stage at the end days of their lives. And they didn't ever have it's so often, right? And they've never had a conversation with their dad or their husband or their wife, or God forbid, the child in a younger situation. But if you've never talked about it, it's so much more difficult to be making life and death decisions, perhaps, or those really challenging, complicated decisions. So it's really a gift to the caregivers to have talked about this a little bit, because then when they go sit down to have to make some difficult decisions, they will know in their heart of hearts that they've talked about this with their loved one and they know exactly what they would have said. You know, when I'm in family meetings and people say, well, I don't really know what they would have said. It's so hard because I don't know either, right?
Yeah.
The patient's too sick now to have the conversation with me. And so what I say to them is think about who your loved one is or was and what kind of person they were and what was important to them. And if they could be sitting right next to us in this meeting, what would they say when they heard everything that the doctors are saying? But can you imagine how much more effective that would be if they actually had that conversation with
Yes.
them and
Yes.
not guessing as to what they may have said in certain circumstances, right?
Yes.
But if they've already talked about that in some sense, they can with confidence say that I know I'm making the right decisions that they would make.
That is great information, and you really struck a chord with me because we may be making decisions, and the more sense we have of what our loved one wants or is so important. So thank you for sharing that. You also mentioned, and we mentioned at the beginning, that this is a sensitive topic. I would just like to ask you if you have any advice. As you mentioned, sometimes we never talk about the subject. What kind of advice can you give to those of us who may be struggling to find the words to say to broach this subject with a loved one? What advice would you give us?
I would say partly you have to first, before you start this conversation, be honest with yourselves about what kind of relationship you have with that person, right? To honor the spirit of the way you speak to each other in general, right? Whether you have a close relationship or not, to honor that if you don't have as close a relationship as you would want, is to find the opportunities that you do find those moments of clarity where you could sit down and talk, together. trying to find a non-threatening way to do it, right? Not to set up this whole board meeting of all the family members to sit around and stare at someone at the end of the desk and say, what do you want to do, right? It's in those soft moments that you really get a lot more about the person. So it's maybe when something comes up about a friend or a loved one who's ill, or you go to your last doctor meeting, and instead of just, if the answer is how was the doctor, and they say fine, say, oh, really, what did they say? Try to engender some of those conversations, that it's kind of like when my kids come home from school and I say, how was school? And they say, it was great or good or okay. And you can either choose to leave it on the table at that, right? Or you could say, you know what, I really am curious. Can you tell me one or two things that was new for you when you met the doctor? And that gives you the opportunity to say things might be changing in their illness. Maybe if you are a caregiver for an older person who may not be able to provide that information so easily after going to the doctors, maybe consider going with them to the doctor so you can ask some of the questions that you want. But really, when it gets down to the conversation, it's really just open-ended general questions. Mom, we just got either some bad news, right? Or some unsettling news, or just that things are just not feeling right lately. And really, what do you think about it? And to think about what's important to you. If you got sicker than you are now, I'd really like to know how to best decide what to do and help you, and what's important to you in this time of your life. What's really the quality of life measures that you really want, right? What's important that makes it a good day for you? Because that helps guide us as to what medical care can do to achieve those goals. It's identifying those larger quality of life goals. It may not be the nitty-gritty, but it may be just some sense of guidance as to what's really important for me in my life right now. And knowing that helps you guide the next care. So for example, there's some people who tell me just being alive with my family, being able to hold my hand and sit at my bedside is really what I'm hoping for in life. But at the same time, there are people that tell me, you know what, I'm an avid golfer and I want to be able to play golf in my end of my days, or I had this huge retirement plan that I really wanted to do. But as you can guess, you can't have the same medical plan for those two people.
Yes.
Right? Because someone who wants to be able to achieve those functional goals of playing golf or doing some other hobby that they wanted to do need to really be well enough to be able to do that.
That is excellent information. Thank you so much. And I am going to remember your suggestions for starting the conversations. And I think it's really important what you said. It really depends on the relationship that you already have with the patient. So thank you so much for that. We are still in the midst of a pandemic, and I did want to explore a question related to that, and that is, do you find that these advanced care discussions have increased in light of COVID-19? But before we do that, what I'd like to do is take a quick break right now, and then we'll be right back. So don't go away.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks, at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back. We're discussing managing end-of-life decisions with Dr. Shira Goldberg. And before our break, I asked Dr. Goldberg if she finds that in light of COVID-19, are there any difference to ACP discussions? So Dr. Goldberg, I wanted to give you a chance to respond to that.
So with all of you hear about the news, you would think that the answer is yes, but unfortunately probably not. Majority of the cases that are really ill from COVID-19 are acutely ill, where they get ill pretty quickly. And so we're not really having the opportunity to really have an advanced care plan. We're really talking about end of life care many ways, unfortunately, in the moment. And so it's hard when you have something that's so new and so quick to change someone's life to really have an advanced care plan. But we are having end of life discussions, unfortunately not with truly many advanced discussions.
I see. Thank you so much. Okay, now I would like to ask you about palliative care. What is palliative care and how does it differ from hospice care?
Excellent question. If who are viewers out there, this is probably the most important thing I think for you to hear about, because when people hear palliative care, they're usually very fearful that what is palliative care? And mainly that's because they think of it as equatable to hospice. And hospice is end of life care where we are no longer pursuing curative therapy or treatment for the underlying illness. And our goals have switched to just be focusing on comfort and not pursuing any more medical care. But palliative care is totally not at that point. It may transition to hospice, but what palliative care is that even as you're pursuing medical care for your illness, the goal of palliative care is to identify symptoms to help you be more comfortable and help you get through all those treatments with identifying, again, your goals of care with the advanced care plan, medications for symptom management. But it is concurrent with any treatment. There is no prohibition to use palliative care as a support system for patients who are undergoing treatment for a medical illness. It has no ramifications for those decisions, different than hospice, where you're not choosing to take on any of those medical treatments during that time.
Terrific. Now I understand. One quick question, if I could, just about hospice, because
Yeah,
I
sure.
want to talk more about the palliative care. Is hospice necessarily an inpatient experience? I mean, do you have to go into?
Yeah, sorry to interrupt. Actually, majority of patients are not in the hospital. That's kind of the goal of hospice, is to really be at home in place. Most people think of hospice as the services you call when someone's very imminently dying. But actually the benefit of hospice, you have to certify that they are likely to have some complication of that disease, that they'll pass away in 6 months. That's a long time for someone who has a chronic illness. Unfortunately, what happens is that many providers are not referring to hospice until the very last moment, which is the root of all these misunderstandings of what hospice is. Majority of our patients are at home, either their home, their loved one's home. Sometimes they're in nursing home facilities because that is their home for now, because home wasn't feasible for them. But there's very few that are truly in the hospital on hospice. So that's the goal. The goal is that we've identified people who no longer want to be in the hospital. They want to be home with their family and not be in and out of the ER when they have an issue or hospitalization. They just want to focus on their comfort in this new journey of their care.
Thank you so much for clarifying that. Let me ask you, what are some of the barriers and challenges that you face in providing palliative care?
So I think the big one is what we just kind of discussed, is that when you say the word palliative care, most people think it's hospice. And so they shy away. They say, oh, we're not ready for that.
Yeah.
But really, everyone should be ready for palliative care. It only provides supportive care and help for someone to make it through their treatments, whether that's for cancer or congestive heart failure or a stroke or dementia, memory loss. All those things are such a huge burden for family members, for caregivers, for the patients themselves. And palliative care along the way kind of reminds them, remember that guiding light? It's kind of a blip in a memory, is that this was the guiding light you told me. You remember when you were first diagnosed? This is what you told me was really important. And then any treatment that comes along, you always ask yourself a question. Is this getting me to my guiding light? Is this my overall goal? Is it getting me to the quality of life that I wanted? Because it's reasonable and logical to say, you know what? If I'm doing treatment that isn't getting me to where I want to be, should I continue doing it? I don't know, right? We don't have to do things just because you can. I actually had a conversation very recently with a family that were struggling with the decision about whether to continue cancer treatment when they knew that their loved one was very ill and weakened, and they were worried about whether that treatment was going to help. And what I said to them is that you might think, and it's really hard to say no to something that someone's offering you that might give you some glimmer of hope, but you don't even realize how strong and honorable it is to make a different choice, right? Is to say, you know what, I just don't think that this is right for her right now, because it's just going to cause her more grief and discomfort. And in the end, we're back to where we are right now, that she may not make it through this illness. And so we're fighting. People say, oh, well, it's giving up, right? And they're fearful of considering that.
Mhm.
But really, it's that you're fighting for something different. We're not fighting for a cure of the disease, but we're absolutely fighting for the importance of their quality of life and for the life that they want to live, even if their time is short.
Thank you. Thank you, Dr. Goldberg. Let me ask you, what do you see as the future for navigating all of the options for end-of-life care?
My hope is that the providers, the doctors, who sometimes are also a barrier in the last question you asked, to refer earlier, to realize how much benefit we can provide to help support patients and their family unit to make it through the illness that they're experiencing. I think the next generation, my generation perhaps, or even younger, right, are more empowered to speak up, right? And what I do when I speak with older patients or their family members is to realize you are in the driver's seat, right? There's so much respect. Maybe that's a bad thing. The younger generation doesn't have as much respect for what the doctors say, right? But in a way, it's positive because they question them, right? And in the older generation, they don't question it. The doctor says you do it, you do it. But I think what we're seeing, and what I hope for the future of palliative care, is that it's okay to question what the doctors are doing, to remember that it's my life and it's my quality of life. And you should feel empowered to say, I'm not really sure, even though it's a good treatment and maybe it would help, I'm just not sure that it fits into the way I want to see my life go for the next few weeks, months, years, whatever that is,
Mhm.
that's what I pray for, is that people feel that they are in charge of their care, and that they are just in a team with the doctor rather than, the lowly page who's just following the orders of a king. I just think that is a generational change that I think will be different. And like you said in my introduction, my mantra is, when I teach the next generation of doctors, is to realize is that it's not a failure to say that people die. It's that they're going to die anyway, but how are they going to die? And are they dying in a way that they want to? Are they dying at home with their family members? Are they dying sick in a hospital bed all alone? All those things are really important for us. And it's just as important for us to know that about a patient and what their needs are and what they want, just as important as writing the prescription for the medication that's treating their illness, because that's them. That's who they are.
Yes, yes. Wonderful. Thank you. And I just have I have a follow-up question that's related to what you just said. And it goes back to having conversations. And I'm wondering, how do you approach and guide families who want everything done for their loved ones at the end of their life?
So the first thing I asked is, first of all, I make sure they understand the medical illness, because a lot of this, I want everything, is because they don't really understand what the prognosis is for their loved one, what's actually happening to their loved one's body. And I try to get to the root of why they're saying it. You know, people say that for many reasons. It could be because they're fearful of symptoms, which I can absolutely help with, right? It could be because of religious or cultural components for us to know and respect, to be able to identify why they're saying those things, right? It comes from somewhere, right?
Yes, yes.
It may just be because they just need an outlet to talk about how they can't even imagine that their loved one is going to pass away. And it really is the why that I always reach out to, is why are you saying that? You know, what are you hoping to come out? And in reality, even though we really have medical advances that are wonderful, we really can't fix everybody. We'd
Yes.
love to, but we really can't. And so knowing that maybe their loved one is in that situation where they aren't going to be able to be fixed. Sometimes when they understand that a little bit better, then they realize, you know, maybe there's some things that we don't want to happen. Another strategy that I consider sometimes is for them to understand, if you would do everything, what would that look like?
Oh, yeah.
And because people don't understand, they say they want everything, but everything for someone who's very ill may not mean that they're coming home, may not mean that they're not institutionalized, needing supportive care for the rest of their days. And if they tell me that dad I want everything for him, but dad wants to come home and be the man he was before he walked into the hospital, if medically that's really unlikely to happen, then I try to be upfront with them, you know, in a caring, supportive way, but to be upfront with them as to whether that's even feasible. Obviously, things happen all the time that we can't explain in medicine, that people recover from things that we don't know, but you go with what the likely outcome would be. And that sometimes changes what they're thinking.
That's really good information. Thank you, Dr. Goldberg. And we have a little less than a minute left to the show, and I wanted to give you the opportunity to leave us with any additional information that you think is important for us to know about not only managing end-of-life care decisions, but palliative care, hospice care, or anything that is important for us to know.
I think the root in all that we're talking about is to sit down and listen, to sit down and hear what your loved one says. You may have your own personal beliefs or values that may be different than the person that we're talking about. And I think when you sit down to have these conversations, although difficult, is to remind yourself how important they really are. And what I say to people who are fearful of it all the time is, remember, you're going to have this conversation, then you box it up in a little box with a bow and you put it aside. But the value of having had that conversation is, know when you do need it, you always know where that little package is. It's off to the side. And when you need it, you open it up and it's a gift that you now had that conversation. Maybe it was a year ago, but you've had that conversation and now you could say, you know what, now I know what we need to do.
That is terrific. Thank you so much. Dr. Goldberg, I have so enjoyed this conversation. Thank you so much for giving us so much valuable information. I now have a much better understanding of palliative care, and it's been very helpful. So thank you so much for sharing with us today. And also thank you for all your work with families and caregivers. We appreciate it.
Thank you so much for having me.
Our pleasure. Thank you. And many thanks to our audience for joining us today. I hope that you also found the information useful and relevant. If you did, please share it with your family, friends, and neighbors. Please join us for the next edition of Caregivers First. Until then, stay safe and take care.